John, wearing a T-shirt is my thing. What's going on here?
Oh, come on. This is the Paris Olympics here. I want to celebrate the incredible achievements of our Olympic athletes, David. So a T-shirt is what they get.
April, have you been
And
watching?
I have been glued, and I'm not normally. And I have to say, too, I've been so impressed by how all of the participants have been holding each other up and supporting each other. And I loved when Simone Biles responded to the news guys who said, "What are you doing
Yeah.
next?" She's like, "Let me just live and enjoy this." I thought that was such a great statement, but I could never do anything that they do. It's just so impressive. So go with the T-shirt, John, definitely.
Yes, yes. And go breakdancing from the guy
April,
from Brooklyn.
the hairs are standing up on my arm when you talked about Simone. Did you see her bowing down to the
Yes, to
Andrade
Rebecca
from
and
Brazil?
Yeah, that was so beautiful.
It was beautiful. I have to tell you, and it's even now, I felt almost like in tears. We don't see that kind of sportsmanship or
Yes.
sportspersonship as much.
Yes.
And she and her colleagues, it was both she and Childs, did it
Yeah.
together, and it looked so natural. It felt like incredible love.
Yeah.
And truthfully, my theme song for the past couple of years since COVID is "If we don't start being more kind to each other, we are not going to survive as a species."
Yeah.
And when you see
Amen.
Simone and Childs do those kinds of things, you say, "Oh, we're going to make it."
Yeah.
These folks are getting it. They know we have got to acknowledge and hold each other up and keep each other going. That's how we're going to make it and get better and stronger as we finally come out of the COVID and start recognizing how to take care of each other and reduce some of the mental health issues that have just been, expanding all over the country, the globe, really.
Amen, April.
All right. Well, let's get this podcast going.
Let's do it.
Okay, we're ready.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Well, hey there, and welcome back to Lifelines, the 988 podcast with David and John. If you're a crisis junkie, you're in the right spot. The water's warm, so jump in with us today as we have an amazing guest. And at the same time, we're also aware that for many people in a mental health, substance use, or suicidal crisis, the experience they have is cold water to the face. So we've got a lot of work to do. We want to keep building on the rich history and going forward. John, tell us about our amazing friend and guest that we've got with us today.
Amazing indeed. Dr. April Naturale is the Vice President of Disaster Services for Vibrant Emotional Health, and she's done stints at Vibrant and its prior incarnation, the Mental Health Association of New York City, in several roles that I know near and dear, including acting as the founding director of the National Disaster Distress Helpline in 2010 and 2011, and the National Suicide Prevention Lifeline's first director of network development in 2004 and 2005. Now April's niche, David, as you know, has been primarily in disaster mental health response, trauma prevention, recovery, and she is an internationally renowned thought leader, responder, and consultant for communities that have experienced both human-made and natural catastrophes, beginning with her leadership as director of the legendary Project Liberty Crisis Counseling Program for New York State in the wake of 9/11. I couldn't be more pleased and proud to be welcoming you here today on our podcast, April Naturale. Welcome.
Thank you, John and David. It's a privilege for me to be in the company of those of you who are doing such incredible work and also have histories that are outstanding in getting us to where we are and being able to help people across the country and across the globe. We're all in good company. We continue to learn from each other. And again, it's an incredible privilege and an honor to be here. Some of the best work that I've ever done has been with the National Suicide Prevention Lifeline, which is now 988. And of course, disaster work. It's a special place to be. And, you know, people always say, how can you keep doing that work? Isn't it depressing? It never has been for me, mostly because I consider it a sacred place. People's defenses are down. They let people like me come in and the other disaster responders, and they allow us to be in this sacred space with them. So it brings so much meaning and purpose to my own life. I've gotten as much out of it as I've given to people. And of course, working with people like you and David over the years, we see that this is what's going to help us get through these mental health and other crises that we're experiencing across the globe.
Yes.
April, thanks for being here. This is episode 21. And
Wow.
For those of you who are joining us, you can watch us on YouTube or wherever you get your podcast, but like and subscribe. John, the way we always start is we get to know our guest a little bit better. And of course, you and I know April well, but April, tell our audience maybe something personal about yourself that they might not know.
Well, I tend to talk a lot, so I'll have to focus on something. But for me, right now, I think the important thing that I like to tell people is I live out on Cape Cod in Massachusetts. And for somebody who's been a responder for the past 30 years, who's not really learned about self-care until maybe the past 10 years, and I'm still not the best at it, being in a place and an environment where I can enjoy nature and be outside. It was especially a blessing during COVID when I could be out in the community and not worry so much. It's really a gift. So I've learned that probably one of the most enjoyable self-care activities I can do is visit different places around the country. It's my goal to get to as many of the national parks as I can. And I encourage others too.
Okay. Terrific.
Yeah.
So, John, the other thing you and I do is, and we have guests that we don't know their personal lives at all, and others we know a little bit better, and you know April well. But we're going to do something we call, what is April a super fan of, April? And we're going to take a shot, John and I, at writing down on a piece of paper. John, I have to get a marker here.
Okay.
I've got my marker here, David.
For us to write down, what is April a super fan of? And she's going to judge, is either one of us close? John, you got a leg up. This is not fair. You worked with April first.
Well, yeah, but I'm going to try to get really specific here because you just gave us a little clue as to something that you're interested in. So I think that's off the table, David. We can't talk about travel, right? Okay.
Yeah, no, travel's off.
Travel's off the table.
That's right.
So we're going to take a
That's
shot.
right.
There's a lot of things I don't know about you as much as I do know about you. So I'm going to guess what you're a super fan of.
Before we do that, April, do you know what John is a super fan of?
Oh, geez. I'll have to think now. We haven't had a chance to chat in a while, but I know one thing he's a super fan of, probably a couple things, but might have to give me a hint. And I'm ready to give you guys a hint too.
No hints for us.
No hints for us.
Yeah, we don't.
No.
John, you're a super fan. What's your super fan you're going to mention today?
Okay.
Well, I mean, right now it's the Olympics.
Yeah.
Right.
And John, you and I were talking about it before the pre-show, how much we forgot that we're super fans of track and field.
Oh, yeah. Yeah. I only see it once every 4 years.
Yeah. All right. So, April.
Okay.
Ready, John? I'm going to say.
All right.
This is fun. I can't wait to see what you come up with.
Yeah, and David is he's quite an improvisationalist.
Okay.
I've made a guess. What do you have, John?
All right, we'll see. As a person who loves the outdoors, I'm just going to guess painting. I mean,
that's great, John. Okay, so you get points. Ding, 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 ding. But I have to tell you that I paint. But I've taken lessons and I watch all these people who are wonderful. A couple of friends of mine have actually moved on and done some really good work and are actually artists and sell their work. But I usually get the go around from the art teacher talking to people and saying, oh, yes, try this, try that. Go here. Okay, do this, do that. And they come by me and go, and keep going. Because
people were a super fan of your painting.
Right. No, I love doing it, though. You know why? Because you don't have to think about work. It's the only time I really don't think about work at all. I was in a class once and somebody dropped an entire bucket of water on the floor and everybody just looked at it and was like, so what? It was great. So, okay, you get points. You're on target. I do love painting.
All right, let's see what David said. Let's
John
see what yours is.
I've got good points. April, I said you're a super fan of holidays.
Oh,
And David just
goodness,
drew
David,
that.
that's cheating.
Just
Who
drew that in
isn't?
5 seconds.
Nice
Well,
job.
so John, I didn't do this, John. I didn't do this because that would be cheating, but someone else might look on your Facebook page to try to
I know,
find out
David,
what
you
you're
would
a
never
super
do
fan
that.
of. And on your Facebook page, April, there are so many pictures of you in
Wow.
costumes at Halloween. It's like Halloween and
That's the
Christmas
only
over
time you ever post, though, right? I mean, or when you're traveling.
That's true. I've been posting. Yeah, I sometimes try and post when I'm traveling too. But yeah, it's really interesting. I moved into this small rural area in Cape Cod, and when I came from New Jersey, Halloween would come and nobody'd come to the door. And here, people were warning us in the neighborhood, "You have to be ready for Halloween. You have to be ready." And I'm like, "All right. Like, how bad could it be?" 150 kids later.
Oh, wow. A
Yes, the
lot of candy
place.
going out the door.
Oh, I stock up a lot beforehand and glow sticks, but they dress up really well. The parents come out, they bring little chairs to sit in the cul-de-sac and watch the kids go around. And the police come and put their lights on because it's a dark street, and they open up their trunk and they do the trunk or treat things. So we have an absolute ball. It's really fun. So, all right, David, you get points too.
That's
You
great.
absolutely get points for that one.
All right,
right,
who
okay.
gets the most points?
And
That's all that matters. Whoever gets the most points here.
All right. So, John, we're, we're going to get into the real deal here with April. But first, tell us a little bit about our sponsor, Behavioral Health Link, and its crisis coordinating software platform.
I will do that, David. When disasters affect communities, coordinating communications with responders is among the most important thing that your behavioral health leaders are going to rely on to keep their people safe. You're going to need an air traffic control system to take calls from people in distress seeking help and services, and you're going to need to dispatch nearest responders to impacted areas, and you're going to need to connect people to continuing care, and you're going to also be able to help some people find an empty hospital bed as soon as possible. And you're going to need the BHL platform to do that. And that was born to help Georgia respond to community-wide needs in the wake of a devastating series of Gulf Coast hurricanes in 2005. The platform, which has since been designed to provide coordinated crisis care for individuals in over a dozen states. So to learn more about the BHL platform and how it can help you coordinate your services responding to both individuals and communities in crisis, visit behavioralhealthlink.com. David?
Great, John. So, April, our next segment we call the good news, and there's so much great activity happening in the 988 and crisis care space. But one of them is, April, you probably are aware that Vibrant and SAMHSA are working on launching 988 Day.
very exciting. We are just thrilled that we've been able to get 988 going. As John knows, got this all prepared and ready to go. And there's so many ways to help people become aware of 988. And having a 988 day is great. And I think what it does too, David, is it allows conversation. It says it's okay to talk about these things. It's okay to talk about crisis. And the line that they put out there is no judgment. I love that. I love that because stigma, as much as we've been fighting it for the past 30 years with colleagues of yours and mine in places like NAMI and the Suicide Foundation, just all these groups that have been fighting stigma for 30 years, it's still out there. And so this idea that it's okay to talk about it and that we have a day to say we need to acknowledge that this is something we need is really important. So thanks for acknowledging that. We're very proud of it.
I think it's great, April, and that you're noting that no judgment. So many people make a call because they realize something is wrong with me. The last thing they want to hear, though, is for somebody to say there's something wrong with you. So really, that is
there you go.
It's so powerful and important to have somebody just listen, understand, and help you feel less alone. And that's what 988 does.
So 988 Day is going to be on what day, April?
Oh, that's a good question. I don't know, David. I'm sorry to say. Sorry to say. I don't have it in my head.
Yeah, so 9/8, September the 8th, which, John, you said is going to launch on the first year on a Sunday. But
on a Sunday, first day of the week.
When I think of World Suicide Prevention Day, it's not intuitive as to what day it is, but 988 we'll know going forward because it's that 9 and the 8. So
Yes, it is.
All right, you figured it out.
And David, 988 day happened for me every day before, so it's I'll be celebrating it just on Sunday.
It's true. When it's in your head every day, kind of those special days, they
Every
meld
day,
more.
every night,
Yeah,
every morning, yeah.
for
the
sure.
other good news, John, we had was we in Crisis Jam yesterday, Phil Evans from Protocol, and we did this crisis trivia question about the concept of funders providing the minimum required to blank core crisis availability. And we've done this trivia question, April, several times, but Phil Evans, he runs one of the largest crisis call networks in the US. Do you know Phil, April, by chance?
I don't know him in person. I've certainly heard of him. And, we've been working very, very hard on coordinating between crisis care and implementing, with the rest of the community members who need to respond and actually, do the work on the ground. So we're very aware of those like Phil who are out there and doing great work like this.
Right, and so the answer here, John, is actually D. That from this firehouse model that Phil talked about, the provider organization has to coordinate, they have to implement, they have to supervise and train, and there's a host of other challenges that come up. And unless all of that is funded and supported, it just won't be sustainable. And we've seen, April, so many crisis services over the last 20, 25 years, innovative programs start but not be able to continue because of the lack of a predictable resource.
It's been a continuing problem, David. I hate to say this, but over the years, we have seen this loss of gains that we had made in helping communities to be able to prepare and to be able to do things immediately in the crisis space, especially when a large-scale disaster happens. But that's not to say that it's not as important, even in small communities. And we know so many rural communities across the country really suffer when they're hit by some kind of a crisis. So this idea that we need to get back to preparing and making sure that the work that we do is sustainable so that we don't have to start over and over and over again every time an incident happens. I don't know how much we can stress this across communities here and even in other parts of the globe where they're seeing even an increase in some of the climate change implemented disasters as well.
Yeah.
David, I love that presentation by Phil.
I have to say, too,
well, I was just going to note, April, that a couple of things I really enjoyed about Phil's presentation, one of which was that it is a reminder of how you've got to sustain the funding in a way that allows counselors to be available to answer those calls quickly. And that's a really important message to funders who feel like, no, they've got to be busy all the time. Right. If they're busy all the time, they're never going to answer the call on time. So that's really important. And also, thing I loved about it is that he compared it to firehouses, which we all value the first responders who are in firehouses. We need to equally value monetarily and in our hearts and souls the work of crisis workers in crisis centers who are answering those calls.
Yeah,
for sure, John. And the idea that they are, and I've been saying this for a long time, they are some of the best trained people to be doing this work. And I come from a background, I'm a PhD level social worker, and I can tell you that there were courses that I've gone through and studies that I've gone through where we didn't learn how to do this. It was not part of the curricula for many professional mental health providers in the country. And so when we talk about the crisis counselors at these call centers, we can say hands down, they are some of the best trained people in the country to do this work, and we can rely on them.
Yes.
John, April, the other good news that we were talking about offline was that you have a new CEO at Vibrant Emotional Health. April, you want to tell us a little bit about that?
We do. We're so excited to tell you that Kara McNulty has joined Vibrant Emotional Health as our new CEO. She comes from the Health Division Services of CVS and brings a tremendous amount of experience in overseeing large-scale operations and organizations and doing the mental health work in addition to looking at that broad perspective of overall health, which all of us have had to do certainly since COVID and will continue to do. She's exciting. She's great to listen to. She's also very fun and interested in everything that's going on in the country and within Vibrant, and she's brought some really good energy to us. You know, after growing so much with 988, everybody's been really work focused. So somebody like Kara with this incredible energy, acknowledging the work and paying attention and learning what everybody's doing. And how to keep it going with a real strength and energy. We are so excited and eager to continue working with her. So we welcome Kara with a big open heart.
Well, welcome, Kara. Great news.
Welcome indeed.
So, John, as we look back, you have a long history with April, and the two of you have done such pivotal foundational work for the what led to 988 and additional support to our country.
Yeah, you know, a lot of people know about your origin story, so to speak, April. I mean, obviously, you did a lot of work, and you were working in hospitals. You've been doing this work in general, not crisis care, but mental health care overall for about 30 years. But how is it that you got appointed to Project Liberty? And if you could talk a little bit about what that experience was like when you first walked in that door.
It's the one question everybody always asks me. Actually, it's the opening of my book about 9/11. I had wonderful experiences in the world of mental health and just never left it. It just feels like it's the right place to be. It always has been. I started off as an intern in a medical hospital working with patients who experienced a cancer diagnosis. But then I moved to the New York State Office of Mental Health at a very exciting time when the NAMI was really at its grassroots and just starting. And I got to work with the folks in the New York NAMI organization who were really leading the charge. And we worked on so many projects, the Anti-Stigma Project, and I wound up running the Family Support Services program for the downstate region, which was, you know, New York, Rockland, Orange County, and learned so much about how families bear a huge burden in taking care of folks who are seriously and persistently mentally ill. And how we in the mental health field really needed to do better to support them. And that was a great beginning for me. And I loved that work, and then had the opportunity to run a small private psychiatric hospital in northern New Jersey, which I enjoyed tremendously and did for about 10 years. And then my old boss from the New York State Office of Mental Health, Linda Rosenberg, called and said that Project Liberty, you know, obviously after 9/11, all of us in the mental health field wanted to help. We wanted to know what we could do. And I was consulting for another hospital in New Jersey at the time, but as a consultant, I wasn't obligated to them. So the timing was perfect when I saw that this job was available. And again, I had done a lot of work with families of those who had experienced loss and trauma, started a large new program throughout the state in New York. And I had become a critical incident stress debriefing person from from my very start of my work. I had very early on been trained by Dr. Jeffrey Mitchell himself.
Oh, yeah.
And then in 9/11, when our colleagues from the National Center for PTSD came and taught us how to adjust, and tailor that program, and then all of the other services for 9/11, we were able to do some incredible work in hiring 4,800 crisis counselors in the first 6 months to be able to go out across the city. But I think one of the major things that stays with me, and I think the rest of the country, is working with Mental Health Association. As John knows, he was leading that charge. We launched the largest public mental health campaign the country had ever seen. And I don't think it's been matched, actually. Maybe some of the pharmaceuticals have tried to match it, but they're usually selling a particular product rather than addressing, trauma, and public mental health needs. So that stays with me between the bus and subway ads, the commercials, and all the print messaging to reach hundreds of thousands of people. I don't think there's anything that's ever been like it before. And
brilliant campaign.
It was a great campaign. And I always refer to it. Actually, when I was running the Boston Marathon bombing response, I brought them the commercials and the bus and subway ads to show them an example. And they did something very similar throughout Boston throughout the country, actually, because as you know, people run the marathon. They come from all over to run the marathon, so that we knew that there were victims everywhere. And I didn't know when it was actually going to launch. You know, we had worked on it, and I'm in the kitchen one day. My house is an open setting, and I hear this sound from the TV news, and I go in the other room. It really caught my attention. They did as good a job learning from the other public mental health campaign that New York had run, where they had people with lived experience saying, this is what happened to me. And I was able to call this crisis line and know that I wasn't alone and get some help. And it was an incredibly successful campaign as well. So we know that this kind of public messaging is really, really important.
Yes.
You know, I was assigned in 2022 to the Attorney General's critical incident stress response team to the Uvalde Robb Elementary shooting. And one of the things that's in the report, one of the lessons learned in the report, a huge piece of it is public communications. And I know that both of you are very, very aware, obviously, as you do things like you are doing right now, that these kinds of conversations and getting this information out to the general public is probably one of the single most important things we can do as mental health providers. So we thank you for that, and know how important it is to keep doing that.
Thank you for your work, April. April, let's go back to 9/11 for a moment and that Project Liberty. We searched with the robots, the ChatGPT, what some of the biggest challenges of that effort might have been. So I'm going to list some of those and tell us. That was, scale of 1 to 5, 5 being the biggest challenge, 1 being the smallest challenge, kind of thing. The scale and scope, the sheer magnitude of the trauma, how was that in terms of your challenges, April?
Oh, that's a great question. I would put that at a 3, David, because I think once you know how to set up the structure of an operations and get the staff in that you need, it's a matter of scaling up. And both of you, I'm sure, know this. It's about, making sure that you're aware of when you might have more of a need for staff and having them available and how to pull them in. But once you have that structure of what the program looks like and you can grow it, that part is not as difficult. It takes work, but I wouldn't say it's as difficult as, setting up the whole structure itself.
The second one, balancing both the immediate as well as the long-term needs that people are going to have.
I think we did a poor job in addressing the long-term needs in the beginning, at least, David, because at that time, nobody really talked about the long-term needs. And I know this is something you're very aware of after having done what you did in Georgia as a start and then developing the business that you have, understanding that the long-term needs are endless. And so there are only a couple of organizations that continue to exist who look at the long-term needs of folks who've been impacted by disaster and other crises. So I would say that was so difficult that we didn't pay a whole lot of attention to it. The one thing that we were able to do was some pretty significant training of local mental health providers throughout the 5 boroughs who didn't know how to do things like cognitive behavioral therapy for disaster trauma, right, which is different than a mental health, a mental illness issue, and to be able to really teach them so that they can continue to see people, because we knew people were going to be coming into their organizations, their agencies, and their offices for years to come. And so that was a great effort that was made. Actually, Mental Health Association, John has spearheaded that one himself, is getting a lot of the training done to providers across New York City.
Let's do a couple more, April. What about coordination among agencies? There were so many local, state, and federal, along with non-governmental organizations in the response.
This is something we write about a lot these days, David, because coordination does seem to continue to be a struggle. I always use the example of when I ran a small psych hospital. I was a disaster worker, right? I had done this work and trained in it before, and I thought I got this down pat. And I used to get I had elderly folks as well as kids and middle-aged folks in the psych hospital, and we had to do all kinds of drills, and we were fancy, right? We had pretend pieces of airplanes fall in certain areas and smoke bombs to make it look like fires, and we thought we were doing great. And then the Joint Commission came out and said, that's not good enough. You must do disaster planning with other agencies in your area. Well, when we did that, we found out that we had all contracted with the same local school to be a shelter, and I had like 80, 90 patients at a time, half of them who may have been in wheelchairs or beds. We had contracted with that school, and so did another nursing home and another daycare center. They would have never been able to take care of all of us. We did the same thing with the ambulance company. The ambulance company had like 8 rigs. They would have never been able to take care of all of us. So it really opened up our eyes a lot. 9/11 did give us some cover, though, I must say, David, in those early days when everyone is in the heroic phase and they want to help, they cross boundaries that exist at other times, at non-disaster times. So 9/11 gave us some cover, but I think that was limited. I think they went back to the same kind of turf issues and difficulties in working together. And again, a couple of the lessons learned that came out from the Uvalde shooting, where 19 babies were killed and 2 adults, there was no coordination among the agencies that came at all. And I have to say that that's not unusual, that we do see that in many communities, that they don't work with each other. They have difficulty figuring out even who's supposed to be in command, and how do they share territory. So we've a lot of work to do in that area. I don't know what you've seen in what you've been doing. I imagine it's not too dissimilar.
Last one on 9/11, April, support for the responders themselves, the mental health, those 5,000 mental health professionals that were engaged, and the impact on them of doing the work.
Oh, that's a great question. I love to answer this one. We actually made changes in how the federal government addressed workers and got them to pay attention to and include in future disaster response programs that we had to address the health and the mental health of all the responders, whether it's the traditional emergency responders, to the crisis counselors, to the volunteers. And so it was actually the beginning of very large-scale self-care and stress management programs for the responders themselves, so that we don't wind up losing these people getting burnt out from doing the work that they're doing. So I'm proud to say that that's one of the great efforts and accomplishments that launched after 9/11. Thanks for those questions.
April, I remember. I know you probably remember Bob Dingman, who was the founder of American Red Cross's disaster mental health arm, and when he showed up right after 9/11, and he was the veteran of the wars, so to speak, and I said, what are we dealing with here, Bob? He said, well, let me just put it this way. Hurricane Andrew was a 10. And I said, well, how would you rate this? And he said, oh, this is a 12. Now, that was many years ago, April, and you are yourself probably the biggest disaster veteran ever. You've seen so many disasters of human-caused and natural disasters. How would you rate 9/11 among all of the other ones that you've been to?
Well, I think that, first of all, the differentiation between a natural disaster and a human caused with intent to harm, right, like terrorism or these mass shooting events that we're seeing, they have a larger impact. Actually, we know that 10 to 20% of people can really struggle seriously after a mass violence or a human caused incident with intent to harm, as opposed to a natural disaster. So we see that difference there. But truthfully, probably Hurricane Katrina in terms of a natural disaster, because of the size of the number of states, the geographic area, that 33 states became involved because they took people in from Louisiana, Mississippi, Alabama. Right. Right. But emotionally and mental health wise, the security, the idea of U.S. being a secure country changed drastically in 9/11. And I don't think anything else has had that kind of a negative impact on us. And I do hope that we can continue to try and recover from that and hold each other up. Yeah.
Wow, John. So, John, that Hurricane Katrina was how the three of us started really working together en masse. And of course, the 9/11 work that the two of you did laid such a foundation for 9/8. Brings us to our trivia question. And, we try to make these as fun as possible, but trivia around disaster, April, it is what it is. So I'm going to bring up a trivia question, and I actually have a book. Let's see, where's my book?
Do you? All right. Well, while you're looking for your book, I'm going to give you a little piece of trivia. When John first launched the National Suicide Prevention Lifeline, there was a tech guy and John and me, and we used to have staff meetings. John would come out of his office, and the two of us would stand up from our cube, and that would be a staff meeting for the National Suicide Lifeline.
Yeah, it was nice that you all stood up, though, when I came out. I appreciate that.
So, April, have you read this book?
I can't see it. Oh, yes, I have. I actually have 2 copies of it, David, right here.
So, A Paradise Built in Hell, Rebecca Solnit, she looks at the 1906 San Francisco earthquake, the 1917 Halifax explosion of 2 ships in the harbor.
That's right, in Nova Scotia.
The 1985 Mexico City earthquake. Right. And then the 2 large national disasters that we've been talking about, both 9/11 and Hurricane Katrina. So the trivia question for today, John, the over-under is Rebecca talks about this issue. And April, you were leaning into it when a disaster is done to us by people versus by nature, if you will, or happenstance.
Right.
And she says, regardless of the cause, there are 2 types of responses from human beings. One is caring and supporting and coming together, and another one is taking advantage of the situation. John, according to Rebecca Solnit, what percentage of people in the immediate aftermath of those disasters were coming together, forming supportive, altruistic community and helping?
What percentage of all the ones you just mentioned specifically?
Exactly. So the people in those communities, how did it break down in terms of percentages who helped and percentages who didn't?
Oh my gosh. I would put it in the 90 percentile for sure. I would put it probably maybe even 95%, something like that.
All right, so April, your job is to say over or under. Is John high or low?
I want to cheat. I have the book sitting like right here next to me. I'm terrible remembering numbers, David. No, I would say it might be even, I would say and hope, and from my experience with other disasters, say that it would be a little bit higher, although I think there was more opportunity for scammers, and we know that they do come in. But when we talk about and know and read about and hear about, and I was in and out of Louisiana, Alabama, Mississippi for 2 years after Hurricane Katrina. People come together, David. They do. People come together. They take care of each other. There are always going to be scammers.
It could be like 99% is what it sounds like.
So normally, April, these over-unders, I try to put a lot of thought into the numbers. She doesn't say a number in the book, John.
That was good, David.
I asked the robots to give me a trivia question out of the book, and the robot said over or under 90%. And then I looked for it, and she doesn't actually say 90%. So what the robots are saying, John, is the same thing you were concluding. The vast majority of people
do the right thing.
Yeah, they do the right thing. They come together. I think the one thing in her book is the government response is often Mexico City, San Francisco earthquake. It can be really challenging because it comes in with a presupposition that most people are going to do harm, and then they do harm. That's a challenge that we've had. And the government can also bring a more enormous response like it did in both 9/11 and Katrina. But that's one of the lessons of her book is humans, if you get out of their way, they tend to help each other. How's that pair with your experience, April?
And David, if you probably the correct answer would be if you just did some research on the prevalence of sociopathy, that would be the percentage of people that would be taking advantage of it. Everybody else
helps. Absolutely, David. Yeah, this is absolutely what we see. And if you look at the work of like George Bonanno, who studied, what happens to people after trauma, most people do better. They come together. Joseph Conrad wrote, which I've always stuck with because after 9/11, the responders hated the term heroes. And so I did a little back research on that. And, he writes, the Journey of the Hero. I don't know if you've ever read that's big works. It means we look at each other and we recognize that we're the same, right? That we have to take care of each other. That this is what it's about. That nothing else matters. That you could have all the money in the world. It doesn't matter if we don't look at each other and say, yes, we're human beings and we need to care for and care about each other. And that's what makes us successful.
And April, in the way disaster recovery works, is there's that honeymoon period where everybody is very much together.
That's right.
And then actually a few months later, people start to fall apart.
Well, they start to recognize their losses and can become really overwhelmed and begin to grieve. But what we see, too, is after that period of disillusionment, right, where we recognize, oh, my goodness, right, I've lost all my money, I've lost my home, or maybe I even lost a family member or other loved ones. But we do slowly crawl out of disillusionment into recovery. And that is what we see. We saw it in Halifax. There are some wonderful books written about the Halifax explosion and how people helped each other. I actually went up and visited that area and the museums that talk about. That's an incredible story. The Buffalo story, the results, the lessons learned from that was the community did better without the government there.
Yeah. Oh, I'll bet.
Just like you were saying, David, that the community and that's what self-efficacy, something what we try to bring into communities is they really can take care of themselves without us. And we want to give them that confidence and sometimes have to give them the tools, but they really can recover on their own as they come together and take care of each other. That's really the message.
So we've been talking about some heavy topics. Let's take it even heavier, John. Much heavier.
Let's go down.
Let's go down. I want to see, you two are both quasi wannabe New Yorkers. John, you live in Brooklyn. April, you don't live in New York at all, but you both have worked in New York. So here are 20 signs you might be a real New Yorker. And I want to see, are you guys real New Yorkers or not?
All right.
April, we'll start with you.
Okay.
You have a strong opinion about the best pizza and bagel spots. Yes or no?
Number one, yes. That's like the number one indicator of a New Yorker, of course. And I'm not giving away my secrets either.
Well, that's because you also make pizza too, right? You're a big pizza maker, aren't you, April?
I try to, but I'm not a good cook. But the issue is, like, I live here in Cape Cod. I don't even eat the pizza or bagels here. It's just not worth it. You've got to go to New York. It's the only time I enjoy those things.
It is absolutely a measure, yes, and we both have that.
Okay, here's another one. Number two, you're unfazed by celebrity sightings.
I think that's pretty true. I mean, I wouldn't say I'm unfazed. I recognize them, but I don't react. Like I can remember coming out of the 9th Street Bath Station one day and seeing somebody from Lord of the Rings. What's her name? Liv. I don't remember her last name. And she looked, Liv Tyler thing. Our eyes met and we smiled. And then I just looked down and went past her because I didn't want to be like a geek. But it is exciting. But you can't be fazed by it because that's not cool.
I just recognize it's interesting. I'll just look at them and smile. I mean, it's been anywhere from John Cleese and John Waters and Lou Reed back in the day, and they just appreciate it. Just don't talk to me, but give me a smile, and they know that they've been appreciated and seen. That's all you needed to do.
Yeah, so I'm definitely not a New Yorker, April. A couple years ago, I was at the Beverly Hotel, and Nancy Pelosi was walking toward me with her security detail, and she made that same eye contact, and I just melted into the ground. Okay, so
I have to tell you, it's hard.
It is hard.
Here's one. Number 3, you think a 60-minute commute is reasonable?
Oh my gosh.
Absolutely.
Yeah.
That's the rule.
Yeah,
Anything under 60 minutes is definitely reasonable.
it's true. I used to not complain about my 45-minute commute and actually brag about
Right,
All right.
right.
Last one, I think here. You have a very memorable, outlandish landlord story, John.
it every week. Yeah.
I have a lot of stories, and I'm going to leave you with one of them. Is that everybody says that New Yorkers are not nice, but this is my take on this. New Yorkers are very helpful. You know, people say, "Oh, they're not nice. They're not going to help you." They're very helpful. They're just not nice about it. Like I fell once, and I dumped my pocketbook, and the guy on the left of me took my arm and lifted me up, and the woman on the right of me picked up my stuff from my pocketbook, grumbling under her breath, and she gives me back my bag, and he says, "You okay?" And I'm like, "Yeah," and they just keep moving on. You know, and I have tons of examples like that.
No, they'll berate you while they're changing your tire.
Right, while they're helping you. That's right.
Right.
One of the things we used to do when we were taking a break in Project Liberty, you know, the office was the regional office on 33rd and 5th Avenue. And it was such a cool place to be because we were right next to the Empire State Building. I could see the gorgeous, architecture of the era right outside my window. But for a break, the staff and I used to go downstairs and give tourists directions.
Yeah.
We had a ball meeting people and telling them what to do. So no, it's a great place to be. The people are good there. They did come together. I think they continue to come together when things, are happening. It was shortly after 9/11 that the blackout happened as well. And, strangers directed traffic and helped each other and had people stay in their homes. And we see this over and over and over again, David, and I expect we'll continue to.
April, one of the themes of this discussion has been, in your work, has been the resilience of people, and that most people find a way to cope and integrate these traumatic experiences.
That's right.
John and I were really wanting you to maybe share some of your thoughts on how for us to build resilience.
Oh, goodness. Well, we as mental health people, I think, like to think that it is our professional work that does this. And maybe we can provide, the structure and the organization and the information. But the bottom line is that it's good coping and good social supports that help people to get better. And so the messaging that you give, the structure that you provide that allows people to come together and help each other, and the mental health tools, the coping tools, for those who do actually need to have some kind of formal treatment to make sure that that's available. I think that we can continue to do that and make sure that people know that it's us as human beings coming together that's going to save us. And if we can provide each other and share our skills, share our knowledge, and bring that human compassion and support to each other, we're going to be fine.
April, you and I used to talk about this a lot, and I pretty much attribute you to teaching me this back in the day, many days ago, that there are really two things that were really crucial. And I use this in my psychotherapy often when people are in crisis. And those two things are making sure that you have social supports, as you were just saying, and
Right.
connecting with people as often as possible.
That's
But
right.
the other thing was routine and grounding yourself in while everything else is changing and everything else, other things might be uncertain and scary, your routines are your anchor.
Yeah.
Help you stay, put one foot in front of the other, essentially, from day to day.
Exactly. And that starts with youth into adults, into older
Yep.
folks as well. Because as you hear from Bessel van der Kolk, the big guru of trauma, the body remembers.
Body
And
keeps the
so
score. Yeah.
that's right. So my example of this is you don't want to go back to work. Oh my goodness, this terrible thing happened. I feel like garbage. I don't want to get up and go to work. But you have to, right? We have to function. We have to take care of the kids. We have to, get them off to school. We have to go to work. We have to pay our bills. And you get to your job and you don't want to be here. And you sit down at your desk and you open your computer and your body says, I remember this. Okay. I can do this. This is normal. And it starts to feel good. And maybe you don't last the day because you get sad or agitated or whatever. But the more you get into your routine, we know this is especially important for children, but it is for those of us adults who are dealing with things. And we want to, again, have this sense of competence that we can take care of ourselves, our family members, and recover, no matter how long that takes, right? To get on the path. It may take you a long time. It may take somebody a short time. But I always say to people, if you're on a path and you're not like, you haven't fallen off and are laying in the rocks, right? If you're taking baby steps, I just want to know you're feeling a little better or your symptoms are a little less intense, then I know they're going to be okay.
And April, this hints a little bit at you mentioned earlier about, things that crisis counselors do. You to train 4,500 counselors. But that's not mental health. That's not mental health first aid that you taught people. It's psychological first aid, right? What's the difference?
The difference primarily is that psychological first aid helps to address acute stress, which is usually short-lived and directly related to a particular trauma or an incident that's just happened, within a reasonable period of time. And that's where those numbers that we talked about come in, that you mentioned before too, David. About 90% of the people will get better in a short amount of time with no formal mental health services, hopefully with some good social supports. And of course, for the 10% who may have a list of issues that may have made it more difficult for them, they might need referral. But we know that most people do get better on their own, and we expect that that's going to happen. And we trust that that's going to happen, actually. And so we try to share that with people and let them know if they think they're not doing well, they'll do worse.
Yeah.
So we want them to know that we do have this capacity to recover and get better on our own. And again, that self-efficacy, that they can take care of themselves and their families.
John, the only other thing I think you and I talked about in the pre-show was the differences between 988 and the disaster distress helpline and the supports that they're both managed through Vibrant Emotional Health, but have different purposes, April?
That's a really good question, David. What we found, and I think you probably remember this, John, because you were the one who really went to bat to have disaster distress helpline developed, is that after Hurricane Katrina, when we offered the Lifeline to be a crisis line, we got a lot of people who were confused and said, but I'm not suicidal.
Right.
And that's the difference. That's right. And so the disaster distress helpline, the staff are trained a little bit differently, but it's the same network of folks. So most of them know how to respond to that. But people can say, not have to worry if they have concerns about talking about suicide or saying that's not for me. They can call the disaster distress helpline and, get specifically talking about the disaster. The crisis centers that do answer those lines usually have very specific references for referrals and for resources that people who are impacted by the disaster can access. And so it's a little bit more specific, but it is the same staff who are competently able to address the concerns. And of course, now that it's 988 Suicide and Crisis Lifeline, that's a bit clearer. So that helps people know they can call either line.
And the disaster distress helpline is really helping out now with building those social supports because as my understanding is it can help people who have not just been a victim of disaster yesterday, but 20, 30 years ago.
That's
they
right.
Could be calling and there's some online peer support programs for people to build social supports when people have been through it before. Isn't that right?
Yeah. So this is a really important point. As David brought up before, there's not a lot of long-term funds that continue to come from the state or the federal government after a disaster in particular communities. But the line is the federal support that people can call at any time. And we know people continue to function. We're pretty good at avoidance and denial in our culture. And for some people, especially those in cultures where it's not acceptable to be expressive, they're really good at suppressing this. And then something might happen and activate their memory. And suddenly it's 3 years later and they are very, very distressed. One of the stories that stands out to me was a gentleman in Long Island who had been a Holocaust survivor and had left one of the camps and made a successful life, had a wonderful giant family and a very good life, and was sitting watching the towers being attacked and went into a fugue state and wandered in the streets for about 3 days until one of the Project Liberty agency staff identified that this guy was in trouble and brought him in, and that was his story. He said he went right back to being in the camps, and he said, I had never thought about that before. It didn't hit me. I went on with my life. I wanted to have my life. I was not going to let the Nazis take my life away from me. And he was wonderful, successful, and never had an issue. So we don't know when someone might be activated by a memory that's back in our mind somewhere or an emotion that pops up. And that's why anybody can call at any time. It doesn't matter what disaster or other crisis you've experienced at any time.
April, last question for you. So we've been talking about New York and we've called it the largest mental health disaster response. You talked about Katrina and the scale of that with 33 states. How do you think about the crisis of COVID? And was there a FEMA crisis counseling program in the same way that you talked about for 9/11 and Katrina? What did that look like?
It was very different, David, because it was a pandemic and it involved, obviously everybody in the entire country. And so to have every state declared, it really moved more under the public health emergency aspect of the federal government. And that's why there were funds that were given to individual families, businesses, communities, and states and government agencies to make sure that everybody was addressed. They did not have to wait for each state's governor to make a disaster declaration and access the Stafford Act. They worked under the public health emergency, and that just opened up so many more doors, including the ability for the president to go to other countries to get some types of healthcare needs, whether it was masks or gloves or whatever it was. So it is separate. I think it follows the same idea, though, obviously. What hit me about COVID that was so different too, David, is it really impacted our healthcare workers so strong, like I've never seen before. And I know your organization also works a lot with nurses. I always say, if you didn't know this, I'm going to give you a little tip in life. Nurses run the world. They do. I know doctors don't like to hear me say that, but they do. You should know this.
But they love their nurse.
That's right. That's absolutely right. But to have our healthcare workers impacted in such a negative way and it taking us so long to get to support them in ways that they should be supported and protect them, right? Your first rule is safety. The first rule in disasters is safety. It certainly should be that in public health emergencies as well. So I think we learned a lot from that, and we learned we rely much more on our healthcare staff than we realized before.
Wow, what an amazing discussion and amazing work, April, that has been your life's work and continues to be. But John, that brings us to the amazing true tales, the absolutely true tales of Behavioral Health Link.
Well, we'll see how true they are, David. Go ahead.
Well, the very year that the three of us worked together so closely with Labor Day of 2005 around one of the largest mental health and disaster response efforts of Hurricane Katrina. But these disaster responses can also be very small and community-based, April, and still have an enormous impact. And in January of that same year of 2005, there was a train derailment in Graniteville, South Carolina. It happened to be, John, just about 10 or 15 miles from what was at that time the primary call center we were growing in Atlanta, but Augusta, Georgia was still the headquarters of Behavioral Health Link, just across the state line from this terrible train derailment that unleashed 60 tons of chlorine gas. 9 individuals were killed at the time, but there were respiratory injuries for many others. And it landed up ultimately shutting down a factory, and there were a couple of thousand jobs lost in this small community. So April, those immediate as well as those long term. And we were at the time, this was one of our first engagements.
I remember.
And it wasn't technically our area. We were, a Georgia based operation, but you're drawn into supporting with our mobile crisis and our call center resources, trying to help as we could help. April, any memory of this incident in particular or other similar incidents?
Oh, absolutely, because I think this was another one, David, that really spoke not only to the fact that you had this, the physical impact of sulfite, chlorine, I don't remember the exact gas, but the lack of feeling of security and being okay, and the anxiety that something like that causes. Because remember, too, trauma is not just about ourselves. It's also about our loved ones. It's somebody that not only are we going to be hurt or die or killed, is somebody we love, somebody we care about going to be hurt or killed. And when you have a huge, huge scale and scope of people impacted with something like that, and it's unknown, right? You can't see it. You don't know who's going to be impacted or not by something like a gas. The mental health impacts, anxiety is what can really blow up and turn into PTSD if it's not attended to, or if people are not provided the crisis counseling that helps them to stabilize. So I remember very, very clearly feeling this was quite unique and a very high impact, regardless of the geography that it covered. We know that it really impacted people with mental health concerns in a huge way.
The shtick that we normally have with this segment is I usually say, John, and you were there. Out of respect, I won't do that this time. But John, this is literally about the week.
Yeah.
Within 2 weeks of when you and I started working together in earnest.
Yeah.
With the launch of the steering committee for the Lifeline.
Wow.
And John, that brings us to some plain truth. Not to be confused with Bill Maher's new rules. This is this is plain truth, John, not new rules.
It is, and it's very personal truth, because we were talking about how we all met, and I want to tell you a little bit more about how I came to meet April. I was on a subway train going to my office in Manhattan when the train stalled at the last stop in Brooklyn, and it was a little after 9 a.m., and I usually get into work about 9:15, so I looked at my watch and said, I'm going to be a little late this morning. And after we waited for about 10 minutes, the subway train doors were open, and an Orthodox Jewish man walked in through those doors, and he said, where I could hear this guy in front of me, he was talking to him, and he said, a plane has hit the tower of the Trade Center. It is an attack, and many people are going to die. And I thought, how does he know that? That sounds like a terrible accident. Well, when I finally got to my stop on Broadway in Lower Manhattan, I came up the subway steps, and I saw the smokestack billowing from the financial district about 20 blocks away from us. And I knew then, well, at least one of the things that the guy was saying on the subway was true. And then I walked into our building, and the security guy said to me, a second plane just hit the Trade Center.
Mm-hmm.
And now I believe that both things that the man said were true. So when I got off the elevator, I walked in the headquarters of the Mental Health Association of New York City, where I'd started up LifeNet, the city's behavioral health crisis hotline. And our staff was doing just what everybody else was doing, watching and listening to the news to see if the 4 horsemen of the apocalypse were going to show up.
Mm-hmm.
And that day was the quietest day on our hotline since we had launched 5 years earlier. And we've been really, really busy the 5 years before September 11, 2001. 1-800-LifeNet was born from the Giuliani administration, and our program was the new darling of the city's Department of Mental Health. We worked hand in glove with the city, who helped us establish relationships with the city's 25 mobile crisis teams, the 911 system, NYPD, as well as all the city hospitals and emergency departments throughout the 5 boroughs. And we worked with all of the city's agencies, all of the city's behavioral health providers, and we operated this air traffic control behavioral health meta service for the largest metropolitan mental health system in the world. We also established a 24/7 Spanish language service and one for Cantonese and Mandarin speaking individuals with bilingual and trilingual outreach specialists to promote help in New York City's largest non-English speaking communities. So we've been working with the city's communications team to run our multicultural hotline anti-stigma campaigns on buses and subways running for nearly 5 years. So the point is, David and April, LifeNet knew New York City, and New York City knew LifeNet. But I had no idea that all this time we had been developing an infrastructure to respond to the largest disaster mental health recovery effort in the nation's history. So the eerie quiet of our office on that September morning was interrupted when three leaders from the Department of Mental Health Crisis Services marched into our office with ash all over their clothes. They had just escaped from Tower 7, where the city's emergency response center had been inconveniently located. The city's director of crisis intervention services, Isaac Monserrat, said to me, "Cowboy, we're going to run the whole show through here." I didn't know exactly what Isaac meant by that, but I was soon to find out. Our first task was to find volunteer counselors to join the Red Cross's team at the city's armory, where thousands of family members were being directed to for tracking their missing loved ones. And this was a 24/7 operation that was to last for about 3 months. Now, finding volunteer counselors was not that hard at first. In the early days after 9/11, LifeNet got more calls from mental health professionals seeking to give help than people seeking help for mental health professionals, because that's what us mental health professionals do when we're freaking out. Then early the following week, we started to receive many calls for help like we had never received before. These calls came from schools, offices, churches, and community centers where people were afraid to come to school or work, or they were just plain afraid, and they needed mental health counselors to come in and debrief with them, to talk with them about how to cope. Now, it was harder to find these kinds of volunteers to go out because most counselors have been trained to work in their offices, not yours. We had success in sending out mobile crisis teams and counselors from victim services organizations that we've been working with, but the continuing demand for this type of on-site counseling was taxing us, and it was teaching me what terrorism does to communities. And these types of services are exactly the kind that the FEMA-funded crisis counseling programs like 9/11's Project Liberty are designed to provide. Now, it takes time for FEMA to fund states and for them to set up these services. They can't set them up overnight. So what do we do for our needs now? Well, we got to go with the crisis services we have now and collectively improvise with what we got. So it was in December of 2001 that I met April, and she was the newly appointed director of New York State's Project Liberty, which received an unprecedented $155 million from FEMA to engineer the mental health recovery effort throughout the state. Now, she and I became instant partners. She ran the largest mental health disaster program ever seen, and our hotline became the statewide number for accessing all these vital services. And then our work extended for nearly 3 years. We knew that it wasn't just going to take a while to rebuild the fallen buildings. It was also going to take some time to rebuild the traumatized psyches of so many in the New York City area and beyond. Those planes didn't just fly into the buildings, they crashed into our minds. And people reached into their pockets everywhere to help, with private foundations raising over $3 billion for 9/11 victims, with significant amounts going to support the mental health of the 9/11 injured, including evacuees, families, and witnesses. And suddenly, we had to coordinate an insurgence of Project Liberty services and some 50 or more privately funded programs for 9/11 affected people. So we convened and facilitated meetings with all 9/11 mental health public and private programs for nearly 3 years. The innovative services that we created together to address psychic wounds from the largest ever terrorist attack on American soil are stories for another day. But here's the big lesson we learned from 9/11. No matter what FEMA, the federal government, and private foundations can provide your community in the wake of a disaster, response and recovery efforts are, at the beginning and in the end, local. A SAMHSA report on 9/11 mental health response noted in 2006 that LifeNet had a relationship with government at all levels and with service providers. A communications infrastructure like LifeNet's must be something recognized by consumers, government, and providers as a central means of accessing services, and it must be in place beforehand. LifeNet is critically important, perhaps the single most important asset in the response. Well, here's what we got now, David and April. Over 298 crisis centers in communities across the country, better funded than ever. We also live with a growing specter of a climate crisis and human acts of mass violence in our midst. As states and counties are building outstanding crisis care systems, let's not forget that we're also building an infrastructure that will anchor us in times when our community's collective sense of safety and mental health become threatened. In this sense, your local crisis center is the purest definition of a community mental health service. Fund it, support it, tie it into your systems, and savor it. It's the service that never sleeps, so you can get some sleep at night. David, that's a wrap.
John and April, that's some plain truth and a real lifeline. Huge thanks to you today, Dr. April Naturale, for joining us and for your work. And be sure to join us next week when our guest will be Sue Smith. She's the CEO and founder of the Georgia Parent Support Network, and she's thrown her blood, sweat, and tears into supporting the resilience of families, both across Georgia and around the United States in her advocacy work. So thanks for letting us draw you in another week. And we want you to come back next time as we continue to navigate these waters of crisis and care. Until then, remember, every call, every life, every story matters. Stay connected, stay supportive, and we'll see you on the next Lifelines.